Hi, I'm Nicole Coute, and this is anaphylactic shock. Anaphylactic shock is the most severe form of an allergic reaction. It prompts the body to defend itself about something that it's allergic to and it doesn't like. It's trying to protect your body and get rid, block whatever's attacking your body. It's the body's automatic hypersensitive reaction to any allergen, and it has a dangerous side effect with drug therapies, particularly. It's hard for doctors to keep up with their education and also patient records, knowing how bodies change, people's chemistry changes, and they become allergic to things that are new to the environment very often. The causes are food allergies, medicines, not reading the labels, medicines people haven't taken before, people become more ill, maybe taking a medicine that they haven't had to take before. It can cause a reaction. Poison bites of insects, and just poisons of insects, period, but specifically bites and stings, which I'm very severely allergic to, they can cause death. Environmental allergens, those are, pollen, smog, things in the air, fresh mowed lawn, when lawns are, what they call it, scalping, that's terrible for a lot of people. The number of allergens is increasing over time. The symptoms have a wide range, so it's very commonly misdiagnosed. And it can cause death within minutes. The misdiagnosis is the biggest part, catching it right away and knowing your own medical history and what happened to you and the history of what happened to you in the past 5 minutes before you had a reaction can be key when doctors are trying to diagnose. The prevalence cases quadrupled worldwide from 2008 to 2014 and even beyond. Research is showing it's taking about 250,000 lives per year. That's only 1% of diagnosed cases. So who knows, the other diagnosed cases, it may be a higher percentage. That's just what they know of, with people not telling them, people dying right away. Sometimes you don't know if there's no autopsy. Food is the most dangerous factor, most dangerous allergen factor for children under 4 years old. You're just developing, your body's changing when you're very small. Nobody knows what you're allergic to yet. For older age groups, they suffer more from medicinal allergies, from misreading of labels, from them taking too much of something, or for their bodies just being very sensitive. It takes a toll professionally and personally, actually. When your eyes are red and itchy and you have a headache, it's really, really hard to focus at work. It's really hard to focus socially. Nobody wants to be around you and you're blowing your nose and then touching things. And it lowers the social status of sufferers too. You're not as likely to engage, do outdoor activities, or go places with people that you know well. Don't want to be embarrassed. And the increasing number of allergens is causing the surge of cases. So the cause of the surge of cases and why it's quadrupled is because there are more allergens out there. There are, different kind of hybrid plants and things like that in the air and different chemicals in the atmosphere. People are just become allergic to everything. Simple symptoms are acute respiratory distress. Of course, the first thing, you can't breathe, all of your sinuses clog, everything starts to swell. And that's why you get a runny nose. That's why you get a cough, because your bronchioles are starting to swell. You get airway edema, and it's swelling of the airway, and that makes it difficult to breathe. The circulatory shock. So what happens is histamine, when an allergen attacks your body, a histamine actually triggers balsamic cells and some other mast cells to create almost a swelling throughout the body. It actually restricts your circulatory system, and it slows your blood pressure, so it makes you dizzy and things like that, and you can actually get really confused. You can pass out, and then it starts swelling your airway and up through your throat and your sinuses, so everything just tightens up and slows down, and it really, can lead to fainting and passing out, and you need to communicate and recognize the signs right away. You can also hives from a lot of stings. Your body swells up. Nausea, it's because it also attacks the gastrointestinal system. Loss of voice from the swelling in the throat, mental confusion, and then leading to panic. So just keep calm, get on the phone, and recognize your symptoms right away if they're not normal. The treatment and response. So you're going to want to get some high flow oxygen going on, IV fluids, and you're going to want to lay flat, standing up. Your blood rushes to other sides of the body. So if you're laying flat, handle that EpiPen and the antihistamine, which is going to reverse all the swelling, reverse inflammation and reverse the hypotension, sorry. So it'll, your blood pressure will go back to normal, and the swelling in your throat and everything will relax, and your blood will be able to flow, and you'll come back to, if the EpiPen doesn't work, sometimes they have to do a few, you'll get, an adrenaline infusion, but if that's mishandled, it can actually lead to your death, and it can cause heart failure because it's too much at one time. It needs to be administered correctly. Prevention, always adhere to medicinal and drug guidelines. Don't take too much, don't take too little, eat with what you're supposed to eat with, and don't combine, of course, alcohol or any drugs with your prescription drugs. Always stay aware. Your body will react how it's supposed to protect itself. Develop furthering education for physicians as allergens are multiplying. That's a huge one. The world is constantly changing, and older doctors sometimes stay in their ways without realizing that specific allergens they used to treat have actually, evolved. Things change. Researching the case history of patients knowing their own case history and their children's case history is vital. Having access to those medical records is vital. Parental awareness. Like I was saying, know your own allergens. Go get an allergy test done. They have them. It's easier. And then in conclusion, all of my references, one was actually from Saudi Arabia. They were all pretty foreign, but they were all very up to date. They were all very, they all had every single element of everything that I needed. So I used all of them for about every single element. And thank you. Hope you enjoyed my presentation.